We are now joined by President Biden's chief medical advisor, Dr. Anthony Fauci. Dr. Fauci, thanks for joining us again this morning. Boy, it is sobering to hear Dr. Grounder say that she's as scared as she's been at any point during the pandemic. Why is this period so dangerous?
Well, there are a couple of things going on, George. You know, one of the things are we still have a considerable number of cases, even though they've kind of peaked and are turning around and coming back down in the sense of the dynamics of the outbreak. We still have this issue, I believe what she's referring to is the variants that are around. In other words, if you look at what's going on in South Africa, and we have now the variants, at least 2 states and 3 of them, which is the South African variant, which seems to be able to elude certainly the monoclonal antibodies and to some extent the antibodies that are induced by the vaccine. We're still in a reasonably good zone in the sense of getting some protection that you can extrapolate when you look at the effect of other vaccines on these variants. But whenever you have the evolution of mutants, you always have to keep an eye on them because they can get to the point where it may elude the mechanisms that you're trying to suppress it, such as with vaccines.
And that puts the priority on getting as many people these first vaccines as possible. It's leading many to say that we should be delaying giving second doses, push to get as many people as possible that first dose. Is that what you recommend?
You know, George, not necessarily. I think if we have, which it looks like as we're getting through February into March, we're going to get a much steadier supply or cadence of vaccine coming in. Certainly, you don't want vaccines sitting around in the refrigerator or in a freezer if they're ready to go. You want to give them to people. But if you balance it well, George, you can get as many people in their first doses. And then when the next shipment comes in, take care of the people that are about due for their second and then give more to the first. So I think you can accelerate it without necessarily dramatically delaying the second dose. I mean, if you miss it by a few days to a week or 2, I don't think that's a big problem, as the CDC says. But I'd be concerned about delaying it for 3 months or so.
What do you make of that data, though, on the AstraZeneca vaccine, that delaying the second dose a bit may be even more effective?
Yeah, but that's a different vaccine there, George. You got to be careful because you're dealing with different vaccine platforms. The data that we have for the vaccine that we are giving out right now from Moderna and Pfizer, the data we have are solid for 21 days with Pfizer for the second dose and 28 days. We know just from immunology in general that a little flexibility on either end of that is not going to be a big deal. However, if you delay it longer, you don't know whether or not the efficacy is going to be maintained over a period of time, and you don't know how low it's going to go.
Finally, sir, there's this concern that the Super Bowl is going to become another super spreader event.
Well, I hope not, George. I believe that they're trying to keep people separated enough in the stands wearing masks so that they don't have that proximity. If you abide by the 4 or 5 things that you and I have been talking about for a long time, continually wearing a mask, universally wearing a mask, physical distance, avoid congregate settings, and if you're outdoors and you're several feet apart, 6, 7, 8, 10 feet, you could be okay, as long as people abide by that and don't slip.
So no Super Bowl parties?
Absolutely not. I mean, watch the Super Bowl on TV, enjoy it, have a party in your house with your family, with the people who are there. But the one thing you don't want to do, don't want to be, somebody that's putting a damper on anything, but you don't want parties with people that you haven't had much contact with. You just don't know if they're infected. So as difficult as that is, at least this time around, just lay low and cool it.
Dr. Fauci, thanks again for your time and your information.
Good to be with you, George. Thank you.
Pretty consistent message there from Dr. Fauci.
Lay low and cool it. I love that.
You just love it when Dr. Fauci keeps it real, right?
All the time. Well, hey there, GMA fans. Robin Roberts here. Thanks for checking out our YouTube channel. Lots of great stuff here. So go on, click the subscribe button right over here to get more of awesome videos and content from GMA every day, anytime. We thank you for watching, and we'll see you in the morning on GMA.